Today, concerned community members have gathered at their legislators' offices in 5 locations across the state. We have come together because we believe that our current system is an unjust one that rations and denies care. We have come together to hold a community vigil on the basis that the health care crisis is a moral issue that all of our elected officials, both federal and state, must take seriously and resolve.
So as a result, I had to push and push and push and advocate on my own behalf as a patient, not well informed, but knowing enough information to know I need something done. As a result of that, I received different tests, and as a result of that, I had to have 3 surgeries, a bone graft, fusion of my bones, and other negative things that occurred because of the and job loss. Had this been addressed beforehand, all that could have been prevented. So I'm a firm believer and firm advocate of quality health care.
I have been under the coverage of my parents, and then I was under the medical coverage provided by the university. However, as graduation approaches, I grow concerned about having access to affordable coverage. I can no longer chase a dream job based on youthful desire. I have to seriously consider the benefits that come along with that employment. In this economy, not only do I have to worry about the basics of being able to find employment, but I also have to seriously consider if I can even afford the coverage that is being offered. As a community heavily populated with students, the issue of quality health care, a quality healthcare system that is affordable and accessible cannot be ignored by a community in our elected
portion of the stimulus bill helps people make their COBRA payments. The federal government will subsidize my COBRA payment by 65%. And so this personally helps my family and will help every family who's struggling to make those COBRA payments. But I'm one of the lucky people. I'm able, in my personal situation, to devote 97% of my unemployment benefit to COBRA. How many people can devote all but 7% of their unemployment benefit to chasing after that health insurance coverage? It's even though my personal situation is satisfactory, it's not tolerable for every other man, woman, and child in our country to be not, here we are struggling to get our life back together and worrying about our health insurance. But I'm very grateful for the stimulus bill being signed. I'm grateful for the portion that subsidizes COBRA benefits so that, as President Obama said on January 20th, I can pick myself up, dust myself off, and begin again to rebuild America and pursue a full-time position with benefits and have my health insurance continue. Thank you.
So for me, I find it very interesting that we keep going back to the same triangles of healthcare, which talks about quality, it talks about access, and it talks about cost. And it affects everybody. We feel that maybe not my backyard because I have healthcare, I have a great job, but with the economy, we never know when and if healthcare is going to really hit us in our pocket or in our hearts, because we know everybody knows somebody that has healthcare or does not have healthcare. My second story about healthcare is that me and my family now are on Family with Kids, and I want to say this is a bill that I don't think that Mr. Johnson, voted for. So me and my children have it, and we're able to access health care now. And when you are able to access health care, you feel you have a different dignity. You have a different posture, because you know if something were to happen that you can't control, something were to happen where there's an illness or whatever, you can access health care. And so I definitely am an advocate of health care, and I want everyone to know that unless we stand up for our health care, who will? Unless we advocate for better health care, who will? And it's up to us to take a stand and speak up and say, hey, we want to be heard, and we think it's in the best interest of all of Americans that we have quality health care.
There is a statement that's being read across the state today as far as sounding the alarm goes. Across the state this past weekend, hundreds of congregations, including mine, called attention to this crisis. They raised an alarm on behalf of 1.8 million uninsured and 18 people who die each week. Congregations rang bells, blew shofars, pounded drums, a symbolic 18 times. They prayed about this crisis, and they wrote notes to their legislators. As people of faith, people who believe in moral imperative for reform, we call on Representative Johnson and all of Congress to be out in front on this issue. to act now to make quality, affordable health care accessible.
Well, in closing, I just wanted to thank everyone for joining us in meditation and prayer. As we look to the future, hopeful that we will be able to work with our elected officials and our community to achieve a truly just healthcare system for all.